Hey, thanks for watching. Today we're joined by Scott, Paul, and Mike with Direct to MD. They are changing the face of healthcare with a concierge service. Thanks for being in.
Thank you.
Thanks for having us.
Yes. I'm Josh Farley, president of Redline Electric and Solar. Join me as we talk to contractors, business owners, and experts who are willing to share their experiences to help you overcome obstacles when you're taking your business up and to the right. So tell me who started it? What's the idea? Where did it come from?
Well, it was my brainchild a little bit, having had a little experience it's a telemedicine company, essentially. And so I've been an emergency room doc for the past 18 years. I've worked in Scottsdale for my entire professional career. And I guess probably through some of my experiences in the emergency department, it seemed on many occasions, if you're an emergency room doc, you work a lot of evenings. You work
Right.
a lot of 5 to 1s. You got to be there when the people are coming in. And usually in the wee hours, midnight, 1 o'clock, almost without failure, Dad comes in. He's got his 2-year-old under his arm. She's got a fever. She's upset, got a fussy kid. And he's a good dad. But because the situation is what it is, he's working 2 part-time jobs. He doesn't have any coverage. And Mom's at home with the other 2 kids. But
Right.
he's going to go get care for his daughter.
No place else to go in the middle of the night.
He's got no, and the reality is with 2 part-time jobs, he doesn't have coverage.
Right.
And so he doesn't have access to primary care. He doesn't have access. He can go to urgent care, but it's going to cost him $160 out of his
Right.
pocket. There's only one shop in town that's open 24 hours that wouldn't take a penny out of his pocket on the spot.
Right.
And so he comes to the emergency department, and for me, it's hard. I cringe a little bit because you walk in, and he's got a fussy kid, but you look at him, and it's an ear infection. It's amoxicillin. And
Right.
I'm giving him a $2,700 prescription of amoxicillin.
Wow.
And it's just wrong. And there's got to be a better way to deliver that care. You have a level of care delivered in the emergency department where that provider can shock you if you're having a heart attack. He can help you with a stroke. He can crack your chest if you've been shot. And your level of need is down here. It's an ear infection or a flu or a medication refill.
Right.
And that's the $2,700 discrepancy. We're
For
all
sure.
paying for that. And so there's just got to be a better way to deliver that care. And technology has now allowed us to do that. So now, with Direct to MD, we offer access to a doctor within 5 minutes of having, if you put the app on your phone and you're part of Direct to MD, you click on the app, it opens up, you put in your chief complaint, and within 5 minutes you're talking to an emergency room doc. And for the minor medic, a lot of it is agenda-driven. People know, hey, I'm running out of my kid's albuterol. Do I need to take the day off work? Do I have to pull my kid out of school simply to keep my regular appointment so I can get refills for something that we do routinely anyways?
Right.
Blood pressure medications, any type of medication refills, and then there are minor illnesses. It's, maybe an asthma attack, they need more albuterol, or they need an antibiotic for a sinus infection, that kind of thing. Those are the kind of things that really, they hurt employers because it's loss of productivity. People have to leave work, they're missing work, or they're coming in late, leaving early. And maybe they're doing the same thing for their children who don't have access either. And so DirectMD is a solution to that problem. And
So
now,
it was a passion. It was passion to product.
It was. It was.
For
an
me,
idea.
I could feel the emotion in your voice.
Yeah.
That gives me, makes me sad for this dad and his daughter at 2 a.m.
Well, you just know on the backside, it's nice they got care, and you always like to think you're delivering good care, but on the back end, they get that big bill.
For sure.
And these are people that they're calling in to pay. I was the medical director for 6 years in Scottsdale at the emergency department where I worked, and I know that the patients would call and say, hey, I can't afford this right up front. Can you put me on a payment plan? And you just cringe and thought there's got to be a better way. And so that was a little bit of the brainchild of, hey, is there a better way? And actually in my emergency department group in Scottsdale, we had done some telemedicine about 7 or 8 years ago, and technology was wanting a little bit at the time, so the calls weren't super smooth, but we dabbled in it.
Right.
And so fast forward 5 years, I thought, hey, technology has come up to speed. This is something we can implement. We can provide the care. There are doctors out there that want to do this kind of work, and they have the same passion that I do. That, again, if it's adopted on a larger scale, now you change the way healthcare is delivered, and you start balancing out those huge costs.
So, from your brain, from the idea, how did DirectMD come to fruition? What was the next step? When did these guys come in? When did you guys get together? A lot of questions.
No,
You've answered a lot of them before. You answered
bet.
a lot before I even asked them, which is great.
Yeah.
So.
Well, again, we really were founded in January 2016, so we're just hitting our 2-year anniversary. Didn't really see any contracts until November that year, so we've been around 15 months roughly working. But I was still working full time in the emergency department, and this was bigger than something didn't have a lot of entrepreneurial experience or starting a business. Fortunately, I had a neighbor and friend, Scott, who I talked to a little bit, and he certainly had the entrepreneurial experience to say, hey, these are some of the parts. And then Mike, who was a friend of Scott's, the three of us got together and started talking about it. It was interesting that we were all just coincidentally in a position where we had some time and passion.
Gotcha.
To build
So what's
something.
your position in the company, Scott?
I started out as a chief strategy officer, which meant I was going to go out and try to find out who we were going to talk to about our business.
Gotcha.
And that's sort of morphed itself into a more of a sales position. And, we all really didn't know what we were going to do. We had three bodies, and we were very passionate about what we were doing, and we all, I guess, kind of wore three different hats. But chief sales strategy...
Probably still do, maybe more. As far as that.
No, every day's a new adventure, right? I mean, we're learning, we're growing, we're doing things that are different every day.
Gotcha. Mike, what about you?
I had more of a financial background, and when we all connected, we again had that opportunity to have some time and passion towards it. And I've always loved healthcare, and with his experience and Paul's experience with telemedicine already, it was an easy transition to see how that would work, and then. More on the operations side of it, getting into how that platform is going to work. Is it going to be a solid platform, and how we're going to bring in employees, employers, even individuals. You don't have to be an employer to actually have our program. You can jump online and just pop right in and say, okay, I want to see a doctor today, and then with a couple of minutes, you're talking to Dr. Paul Flatley or somebody else in professional. So that's on the financial background, really more on the operations and guiding that in the direction that we want to head. So it's been a great experience so far. We've got a long way to go.
Yeah, no, I think it's great, and I'm looking forward to being a part of it because we signed up. That's how we met. I love the opportunity, and I've used it. I think I even used it on Christmas Eve. I mean, it was sorry to bother you, Paul, but it was just for the little things that you take the sitting in a lobby at a doctor's office. I mean, you just take it out. I mean, because that's really what it is. I mean, you got to make an appointment. My doctor couldn't see me for 2 weeks, or this is I can do it from the privacy of my own home in the middle of the night after work or on my own time. So it's really a concierge service. I mean, you guys are onto something for sure.
Well, Josh, we've also used it. I don't know, between Scott and I and our families, we've got kids, and and in my circumstance, it can sometimes go into the realm where you've got a more serious scenario. My daughter had some bellyache, and anytime you're from here to here, Paul says it's a no-fly zone. This is where we got to figure out really what's going on and do some more tests. And he was able to kind of manage the pain for a little while, but knew if this is going to be a more severe matter, this is where you need to go. These are the weights of these types of hospitals. Don't go to this hospital or this hospital because they don't have peds.
Gotcha.
You need to make sure you go the right direction. So helping navigate that system is invaluable. And so, long story short, within a few hours, we were over at Scottsdale getting the appendix out and avoided a perforation, avoided a longer stay. And within 24 hours, we're out of the hospital and mending. So.
Right. So I mean, this is a good alternative to people that don't have health insurance per se, because you'll know where to go. You know the outfits that take cash on the spot. The ones that can work with the client.
So Josh, one of the things that happened, starting our company was really just introducing it to our centers of influence, our family and friends, and. We thought initially it would be a great program for just families to have, right? Paul's taking care of a lot of the families that we were introducing this to, and we thought, well, gee, maybe it's just an opportunity for them to sign up for a service. Well, what initially happened was you started talking to some of the people and found out that they actually had businesses, and it resonated with them because a lot of them had businesses that were less than 50 employees. And so, unfortunately, a lot of them can't afford insurance. It's just cost prohibitive, right? The way insurance rates are these days. So this was an option for them to be able to provide access to care at an affordable price. And so we really kind of morphed from a consumer product into a business product just because of that desire from the business owners.
Gotcha. Yeah. Well, I'll tell you, every day as a business owner, I look for ways to make my environment more friendly to my employees. Especially nowadays when that's the number one problem is finding and keeping the right employees.
Yeah. Right.
So, I mean, you got Google putting in slides and snack shifts and sleeping nooks and, what can I do to better my environment? I give it to my guys from day one. I mean, I can advertise healthcare concierge service. You come on day one, you've got access to a doctor. I mean, that's big.
Right.
And at the cost, I still don't understand how you do it. at the cost, you guys are so low. Not saying I'd be willing to pay more, but yeah, probably. But I mean, it's just huge for my employees, and I've heard the stories where they've been in need in the middle of the night or on the weekends, and by I think Gavin talked to you, one of my top guys. He was in a hurt, and you guys fixed him up, got him right back to where he can make some money because he's got to provide for himself.
Right.
So you guys are definitely benefiting everybody. Including,
Well, we want. That's exactly what we want to do from the employer standpoint. If we can help, again, it's part of a business to grow it, of course. But if what pain spots can we help with the employer? If we can help with hiring and retention, if we can improve productivity, if we can improve employee satisfaction, those are the jobs we're doing. But for me, on the doctor side, the beauty of that is that we can address that and make a great product for the employer, who's flipping the bill for this, right? And at the end of the day, they are. But the end user, the patients, it's the employees and their families. That's where the fun is, because these are patients that oftentimes just simply haven't had access to care. And I want to provide this affordable access to care when you need it. And now you can do it from your home. And
it's not even the ones that can't afford. I mean, like my wife's a nurse. She's a nurse at Channel Regional, and we get, so we get pretty good health insurance from there, but like you said, it's the doctors aren't open in the middle of the night, holidays, weekends. I mean, you guys are always there. I can't believe the value I find in it and what it provides for my employees.
Well, a lot of the busy executives, time is a huge issue. So
you
just that's if you can, hopefully you pull off to the side of the road and don't dial while you're driving.
Right.
But we've had some of that. We've asked them to pull over. But
no, it's great.
That's a key factor for a lot of the executives out there too, and businesses are the larger healthcare industries that are now plugging in some of this telemedicine into their programs, and it's baked in. And a lot of people don't even know they have it.
Right.
And if they try to use it, there's typically large copays. There's also, doctors out in the East Coast and other areas that they're maybe not familiar with or not have the knowledge of the landscape of Arizona.
Again, there's a lot of players in the space. Telemedicine isn't brand new. It's actually been around over 10 years, and I told you we dabbled in it in Scottsdale several years ago. And some of those companies have become big. They're national, they're publicly traded companies, and so in an effort to start something organic and smaller, how can we be different? How can we provide better services?
Right.
The typical model is a per employee per month fee. The telemedicine companies we go in, and we're not any different. We charge a cost per employee, and then we cover the family and their dependents. And our cost is a little higher than some of these nationally traded ones. But the biggest difference is that we have a higher per month cost per employee, but we don't charge any copays. So most of the big companies like Teladoc, they could go for companies that are 500 employees or more, $1 per employee per month, and then a $25 to $60 copay when the employee goes to use it. And the problem with that whole model is the utilization is awful.
Gotcha.
People just simply don't know what they're going to get. It's daunting to pick up your phone and try to see a doctor, and as a result, it just doesn't work. And at least in terms of my definition of working, people aren't using it. I want to get to that patient. Right. It's a business. I want to make money. Of course, that's part of this. But at the end of the day, I want to impact those lives and help them. And so if it disincentivizes them to use the service because of the copay, they simply didn't do it. We started with a copay and actually switched our model. And I'll tell you what, when we upped our monthly price to the employer and got rid of the copay, the phone started ringing, and now I'm getting to those patients all the time, and that's where
now you can provide a service.
It is,
and provide value.
You bet. So that's one difference. Another difference is, hey, we are small. We're Arizona only, and that's why what Mike alluded to earlier with that example about his daughter. Because the doctors I've hired are all regional, we have a good knowledge of the healthcare landscape of Arizona. So when you do call in with that specific issue, if it isn't something we can take care of on the phone, I know where to send you. I can keep you out of an emergency department that doesn't have the services that you're going to need for your kid. Like Mike was alluding to, I could see at the hospital I worked at all the time. I took care of peds all day long, but if you had something that needed to be admitted, I had to send you to our sister hospital that had inpatient beds for peds. And we try to get you to the right spot, the right time, the first time. And so one is kind of that regional advantage and knowledge is one of the things we offer. I think emergency department docs are uniquely suited for this, so that's what I've tried to focus on, having those kind of docs to help. We don't have a call center. For some of the big companies, again, nationally traded, there's some great advantages to that. You can take care of anybody from any state anytime. Well, we're Arizona. However, when you do call some of the other services, you end up with a call center in those areas. So
do you ever see you guys going? I mean, obviously you're brand new.
Yeah.
You find if you start build this system, you've got something that's scalable.
Yes.
I mean, I foresee it moving somewhere else. Or if your clients here end up moving, they're going to want the service.
You bet. And we are trying to do that. Our growth is going to be a little bit different. Rather than taking my doctors and license them in all 50 states where you lose that regional advantage, that regional knowledge, I'm going to hire groups of docs in each of those areas.
Gotcha.
So as we expand, the idea would be, hey, if we went to Los Angeles, get some docs that know the landscape there. Same thing with Nevada, surrounding states, that kind of thing. And so we eliminate the co-pays, we eliminate the call center, we offer some regional advantage in an effort to be even more robust. Now I've got the ability to send patients. Again, this is oftentimes a cash issue. We've got plenty of patients with insurance that call for the convenience of it.
Right.
But many times they call because this is their only access to care.
Gotcha.
And so one of the things that got the self-pay or the cash pay patients in trouble was, heck, what if I do need labs and x-rays? Now I've got to go engage the system. I've got to go see a doctor or an urgent care and ER just to get that x-ray or that lab. Well, we took that out. Now I've got contracts and I've got cash prices that are really quite discounted. And so now when I see as a patient as, hey, you need that. You've had a cough for a month. We treated you with antibiotics in the beginning. It didn't get better. You know what? You need that chest x-ray. Now I can send you directly to the imaging study. You may have to pay cash, but a cash price for a chest x-ray at some of these places in Arizona, it's $30 versus $300 in the emergency department.
And just walking in off the street, you're not going to get that. So that's what definitely another benefit to having you guys, on our side.
Josh, maybe to add one thing to that. We are an Arizona-based company, but we are portable for our members. So if you, for example, are out of state traveling and you need to utilize the service, we can take care of you while you're in another
24
state.
hours a day.
That's
I
right.
love it.
That's right.
So let's switch gears. Let's talk about the business versus the model. Starting your business, working together. Tell us how the partnership works. What kind of struggles that maybe if you had to go back and do it again, you would have set up to do it a little different. Any advice as far as working with a partner? Maybe now,
part of it
a couple
is the
years
struggle.
in, you're
part
like,
of it is
hey.
the struggle. Navigating your way through, who the right people are to use in certain aspects. And we brought in a lot of amazing talent to help us to be where we are today in regards to the platform that we're working with, really a HIPAA compliant FaceTime type of call, and then making sure that we've got the right measures in place to accommodate the employers when they're coming in and providing the information and ongoing efforts. Scott now has been jumping into a lot of the marketing efforts that we're doing, and again, we've definitely stumbled over the last couple of years in regards to what is the best method on what platform, but it's going in the right direction.
So it's a startup, right?
Yeah.
And so you have limited resources, and if you're not an entrepreneur, I certainly wasn't. I think I got the medicine dialed in and trying to learn how to be a businessman, and which is why you got to surround yourself with people with experience to do that. And so these guys just simply couldn't. We couldn't do it. I think we all need each other to make this work, and we all figure out the right hat you have to wear at the right time. But it's interesting when you have this limited budget. You're like, well, do you just? Are we going to knock on doors? Are we going to put this money? We've gotten several quotes for marketing campaigns that I really think would be huge, but you're trying to figure out, hey, can you earn enough money to pay for that, or do you bring in money? It's all those kind of growth things that I haven't had experience in, and so we kind of group our knowledge and bring in consultants to say, hey, how have you done this? And that's why even an opportunity like this is great. Right. It's just an opportunity for us to learn.
And that's been a big part of helping us out too, as the consultants, the people we've brought in part-time help, and we brought in a part-time CEO.
Gotcha.
Or CFO.
Excuse me, CFO.
Yeah.
We've had some help on the CEO side.
Mm-hmm.
Just some people that have been through it, similar to what we're doing right now, and you're trying to let people know this is what's worked and what hasn't.
Well, I think every business owner, is always looking for ways to get new customers. Like, how do you do it? Like, so what are you guys using? What are you doing?
Well, so
consultant?
we started initially with our friends and family,
Yep.
and just I guess maybe because the idea is so unique and so fresh and so helpful, that there wasn't a lot of pushback on, I think you should go out and meet people. We really had people engaged, and we had people wanting us to meet people that they knew that owned businesses, and it just kind of morphed from there. As I mentioned, we started out really with a consumer idea, but we found out from certain business owners, like, you know what, that's great, but I would really like to have this because I think it would help me with retention. I'm losing employees to a company that does a very similar
Not
thing
only
that I
retention,
do.
but attraction. I mean, it helps you get them on. And I can't remember the last time a service came in and pitched to me that I signed on the that day. Like that, it was a no-brainer.
Right.
I mean, so definitely. No, that's great. So, who is a great fit for you guys? Like, what is your target? We all have a niche, but like, what is it? Small? Is it big? Is it?
It's funny. I think our best target audience is the companies that are 10 to 50 employees. The ones that are under 50, they're not affected by the Affordable Care Act, and whether they want to or not, sometimes it's just not realistic to be able to provide a full level
Right.
insurance product. So if they can provide access to care, oftentimes that's the best they can do, and that's great. Those are the perfect companies for us, because those are the patients that I have found that have the least access to care, and oftentimes they're the hardest working people in
Right.
in the area. And so to be able to take care of them, I love. So those are certainly the best. But interestingly, we have attracted a few companies that are a lot bigger, 200 and 300 person groups that I thought, oh gosh, they're already paying insurance. Why would they add on an additional? And the reality was, it was access. Even if you have the best insurance plan ever, it's flu season here
Right.
in Phoenix. You call on Monday, you can't get in till Thursday,
Right.
right? And so you're waiting. And so this gives you that, hey, I feel my flu-like symptoms coming on. You get that sick on Friday night, well, heck, call me Friday night. You're on an antibiotic or you're on Tamiflu or whatever that need is. We
Right.
address it early, so hopefully we can improve productivity on the back end. So,
That's great. How you guys like being in business for yourselves?
Oh, it's great.
well, you guys, maybe you guys have each had a little of that experience. For me, it's great. Well, it's a different animal, right? I've been on a time clock. Literally, you worked 6 to 6, 7 to 7, overnights, days, and so for the first time, I've had this experience. I think my wife's going crazy because I'm home every night for dinner and I'm home on the weekends, which is maybe not the best
Right,
thing ever,
right.
but it's nice. And so that part of being a business owner is great. But the anxieties come about with that as well, which
Sleepless
is
nights,
I'm lying in bed going, how am I going to generate business? And again, we're small. We have payroll covered and this kind of
Yep.
thing. Whereas in the emergency department, you go work your shift and you get a paycheck every month. And
you don't
it's
have to think
nice
about
and
it.
easier,
Yeah.
you bet. And so as much as I was ready for a change, this has
Well,
been
good
a
for
little
you.
daunting.
It takes
So,
a
yeah.
lot. I mean,
Yeah.
it's a lot of courage to get out there, just follow your passion for sure. But I tell you, you guys are helping. Keep it up. Let's go back to how you guys get customers. What do you feel is the most successful?
Well, I think for us, it's been just the combination of our product works with a lot of people we're introducing it to, so they've felt comfortable referring this unique idea out to people that they work with.
Gotcha.
One of the things that I would mention is we never leave a meeting without asking for a referral.
Okay.
And
that's good advice.
Yeah, it's just and we don't do that if we're not getting a good vibe. But that hasn't happened to the point where we feel like someone's not wanting to introduce us to somebody.
I've got a few. Trust me, I'll give you a few for sure. Let me ask you. So, normal health insurance with the affordable health care. I mean, I don't know anything about it because it's tough as a small business,
Right.
to afford it.
Right.
But thinking about those brokers, is that something that they can? I mean, can you tie that onto any plan, or is it? I mean, obviously anybody can just access it. Are
That's
you
right.
working with those
You
types
bet.
of?
You bet. Yeah, we're broker friendly, I guess
Gotcha.
would be the term, and we work with health insurance professionals, being introduced to clients that they work with currently, and we've had the fortune to go out and meet people that don't have anybody they're working with. It's just really shocking because the insurance world's a little bit confusing, right? There's a lot
For
going
sure.
on there. And to come across a company that has 60, 70 employees that's required to get insurance, but they're doing it all themselves, we've kind of had that ability to refer that back to the brokers. And
I'll
That's
tell you,
daunting. I mean, I'm a
It
little
is.
guy, and
Yeah.
I could just imagine.
there's a lot of moving pieces there for them to figure out. And
For
so
sure.
we've had that ability to go back and forth with the brokers. And
Let me ask you this. So if you go into a company like mine, small, they don't have insurance.
Yeah.
Is it, you guys have a referral partner for like catastrophic? Like what happens? Or do you? I
It
mean,
isn't.
like
we don't
'cause-
have, that is difficult because you used to be able to purchase a freestanding major medical, and oftentimes we've talked about the perfect combination would be a major medical policy that protects you for that horrible,
Mhm.
you have to spend the night in the hospital, spend the night in the ICU.
Right.
It's going to be that could put you in bankruptcy.
For
and
sure.
So to have a major medical policy coupled with direct MD is the best combo, and so we're looking for that. But they've made it difficult to buy a major medical policy.
I remember
now,
the
you know?
days when you could get Blue Cross Blue Shield for your own. Like they had
Right.
billboards, $59 a month
Right.
for yourself, and
Yeah.
then
You bet.
affordable health care, affordable.
Well,
Came around.
We're finally at a point too where we can go back to the employers a year later and really show them the difference, the impact onto their bottom line.
Right.
So it's not just a productivity standpoint. They're actually seeing some cost savings because they're not having their employees leave and go and visit that
Right.
ER, because typically the ER is the first stop and the most
I'm-
expensive.
I can bring. We touch on it every week in
Yeah.
the meetings. Use the app. Get
Yeah.
on there.
You
Talk to
bet.
the doctor. Like don't feel bad.
Right.
Like don't. I mean, it's hard to not feel bad. Like one of our core values is empathy, or we can relate to our customers. So when we get a call in the middle of the night, we understand, but we don't want to be the one to put you up, wake you up,
Yeah.
and get you out of bed.
That's
You know,
what we're here for, right?
But I
No,
tell them,
that's-
use it.
Right.
It. No, it's great. So I've got the system myself, and I tell the guys every week, use it. Is there a way for me to know if the guys are using it?
Absolutely. And we'll provide to you a utilization report that shows exactly how many calls. We question every patient about when we take care of them. Hey, if you didn't have access to this service, where would you have gone? Because it gives us a rough idea of the savings, essentially. When
Right.
it doesn't take a whole lot of diversions at $2,700 a pop from the emergency department to a service that's being provided by the employer to have a huge savings. And that really resonates. One of our larger companies is a car dealership, and they self-insure.
Right.
And so if we can help keep from biting into that deductible, which we're doing, and so to be able to provide them a quarterly utilization report that says, hey, we saw 37 people in November. This is how many people we diverted to
Right.
no care or directly to the pharmacy for a prescription and kept them out of the emergency department, urgent care. That's when you really start seeing that savings.
That's
It makes
great.
a big difference. Yeah.
Thanks. Hey, thanks for coming in. I enjoy listening to the passion. That was a great story. It makes me want to spread the word, which I have, and I will continue. Tell us how we get a hold of you and if you got any special offers.
Yeah, you can reach out anytime on the web, and it is direct2md.com and / up and to the right. So
Awesome.
that'll give you the discount, and we'll bring back to the employee type discount for whether it be consumers or business owners. They can have that discounted rate of $10 to $15 a month with no copays. So it's a great
Wow.
program.
Awesome, guys. Thanks for coming in. Keep it up.
Thank you.
Thank you.
Thanks.
Hey, thanks for tuning in. If you like what we're doing here, subscribe to our podcast at iTunes, Google Play, or Stitcher, and to our YouTube channel to see more episodes. Go to upandtothe right.org to get all the links.